From the battlefield to the emergency room and for long-term care, breakthroughs in medical technology are saving lives in ways never imagined possible. Golani Holding, a pioneer in acoustical devices, is proud to introduce the Eccoscope.
The Eccoscope is a novel airway device that is designed to help with the placement of the breathing tube and its correct positioning within the airway. Using bursts of acoustical signals, it is able to reconstruct the interior of a cavity, such as the lung, in the form of an area distance curve. This can be particularly helpful in certain situations when the tube is partially or totally obstructed.
Without the patient taking a single breath, the Eccoscope can tell whether the tube is in the trachea or the esophagus. Sometimes just a few centimeters can mean the difference between proper and improper placement.
When there's an obstruction in the airway, either within the tube or beyond it, the Eccoscope shows you where the obstruction is and how severe it is. For example, let's pinch the tube and cause an artificial obstruction. Notice that the area trace decreases suddenly, and if we correct the problem by no longer pinching, the trace quickly returns to normal, all in real time. And notice that as I pinch different parts of the tube, I can see where the obstruction is occurring within the tube.
Dr. Collins, the patient's O2 stat is dropping. He's struggling to breathe.
Reattach the Eccoscope.
There's a drop at 25 centimeters distance into the tube.
It's a mucus plug. Get me a suction catheter.
But what if the narrowing of the airway is beyond the breathing tube, say at the level of the bronchi, as in an asthmatic patient? In that scenario, the Eccoscope shows a narrowing of the airway at that distance. And if we give medications to relax the smooth muscle, then we can tell in real time whether our treatment has been effective.
Pull back a little. I think you may have gone too far.
Every year, thousands of endobronchial intubations occur when the breathing tube is inserted too far and ends up in only one lung.
Breath sounds are equal. I think the tube is fine where it is.
No, we're not. The patient is still desaturating. Yes, you're definitely too far. I saw the drop. Pull back.
Oxygen saturation is increasing. I think the weight of the intestines pushing on the diaphragm created an interbronchial intubation.
Golani Holdings has developed a circuit-embedded Eccoscope for patients requiring long-term intubation. Through a novel design, this embedded device is protected from the effects of long-term humidity and condensation, and therefore the instruments can stay in place for long periods of time.
The future of intubation technology has arrived. The Eccoscope provides the simplest and least invasive way to monitor the airway. In certain situations, this could save the patient's life. Eccoscope from Golani Holdings.